Hello, my name is Zhang, and I'm a registered acupuncturist and herbalist. Today, I'd like to speak to you about colitis. Colitis is a very serious disease affecting the life of many people. Some of my patients who have suffered with colitis say that they feel sick to their stomach when they see their stool. They tell me that their stool is bloody, watery, and contain mucus. I would like to share with you the stories of some of my patients that I have been able to help over the past few years. The first patient is a 31 years old woman suffering from colitis for about 2 years. When I saw her, she had inflammation and multiple ulcers on her colon and was used a high dose of steroids to control her diarrhea, mucus, bleeding, and discomfort. In the past, the patient tried to gradually reduce the dose of steroids until she stopped taking them altogether. This caused her symptoms to come back more aggressively, resulting in hospitalization and requiring blood transfusion therapy and other medication. I treated this patient for 5 months, after which there were no more symptoms of colitis. This patient was able to reduce and eventually stop taking medication. The patient told me that based on her experience with me, that she learned to look for alternative to traditional West medicine. The second patient was a man suffering from colitis for about 13 years. He tried many types of treatment therapy without any success. When he first saw me, he said I was his last option, or else he would have to remove his colon. I treated him for 6 months and afterwards, he was able to have regular bowel movements twice a day. He went in for a colonoscopy and they couldn't find any signs of inflammation. The third patient is a 40 years old man suffering from colitis for about 5 years. He had a colonoscopy which showed that he had 40 centimeters of inflammation. He was having 8 to 10 bowel movements a day, which were watery and contained mucus and blood. He was afraid to eat because of the constant diarrhea. For his treatment, I first focused on gradually stop his bleeding, then eliminating the mucus. The patient bowel movement gradually reduced 2 to 3 times per day, and the bloating was eliminated. The patient's symptoms disappeared completely with 2 months of treatment with me, without the use of steroids. Another patient, a 50 years old man, had colitis for 2 weeks by the time he came to see me. He had very severe symptoms, including diarrhea more than 20 times a day, with mucus and blood in his stool. His symptoms totally disappeared after 4 treatments within 2 weeks. He hasn't had a repeat event in the past 10 years. I informed him that as long as I've been in Canada, that he was my first colitis patient to come and see me so soon after symptoms appeared. He said that he felt like he was dying and that he had to explore all options and that he made the right decision to come and see me. Remember my second example? The man who suffered for 13 years. He was recommended to remove the infected area of his colon. Can you imagine how much he suffered in those 13 years? In the last patient example, the patient had severe symptoms but recovered quickly. What does this tell us? It tells us that every patient needed to be treated differently. But more importantly, it is critical that the patient seek treatment as soon as diagnosis is made. The reason for this is that it takes longer to treat a patient who has been suffering from colitis for a longer period of time than one that has been suffering for a short period of time. I treat colitis with a combination of acupuncture and Chinese herbal medicine. The combination of these two treatments improve digestive function and reduce inflammation. Also, you should know that acupuncture and Chinese herbal medicine are natural, unlike a prescription drug. Again, my name is Zhang, Acupuncture and Herbs. Please visit my website. Thank you for your time.